I'm Jessica, and I will be explaining the identification of Pseudomonas, some of its most important basic features, and its epidemiology. Specifically, I will be focusing on Pseudomonas aeruginosa, since this is a species that frequently infects humans. Pseudomonas is a gram-negative rod-shaped bacteria. It can take on curved, straight, or beam-shaped morphologies. Pseudomonas is a facultative anaerobe, meaning it can survive in low oxygen environments. Because of this, it is able to survive in many different places. It also contains a flagellum, allowing it to be mobile and infect many different parts of the body. It is catalase positive, meaning its catalase enzyme can convert hydrogen peroxide to water and oxygen, forming bubbles on a slide when exposed in vitro. It is also oxidase positive. This means it produces cytochrome C oxidase, an enzyme that's part of the electron transport chain of the bacteria. On a slide, it will turn oxidase reagent a dark blue color. It's also non-spore forming. It used to be thought that some species could make spores, but it was later found that the structures seen under the microscope were actually granules of reserved materials produced by the bacteria. On a SBA plate, it is beta-hemolytic, and it often forms a blue-green color on agar, allowing it to be identified. Pseudomonas is an opportunistic pathogen. It often infects immunocompromised people, especially those with cystic fibrosis or burn wounds. Its ability to survive in low oxygen environments and utilize many different sources of organic material allow it to be found in soil, water, and most man-made environments. It's often found in swimming pools due to its affinity to moist environments, where it can cause skin rash and swimmer's ear when infected. It's often found on hospital equipment. Pseudomonas is the second most common nosocomial infection. It can cause ventilator-associated pneumonia, inflammation, and sepsis in patients that have cystic fibrosis. It can also form biofilms, especially in moist environments such as catheters. There it can cause urinary tract infections. It also causes GI infection, specifically necrotizing enterococcus, in which a portion of the bowel is destroyed, and this occurs in cancer patients or premature infants. It can also cause skin infections, specifically hemorrhages and necrosis in burn wound patients. Pseudomonas can infect humans, animals, and some plants.
Defenses for a person confronted with Pseudomonas aeruginosa include normal flora, immune system, and skin. In immunocompromised individuals, Pseudomonas aeruginosa can infect almost any tissue, but mainly targets blood, lungs, skin, ears, and eyes. Pseudomonas aeruginosa has a multitude of virulence factors, but its main ones are quorum sensing, lipopolysaccharide O antigen, type 3 secretion system, and biofilm formation.